Hi, Frank. Thank you so much for being here today.
Thank you for having me. I'm so excited about all of this.
So today we're going to be talking about physical pain, mental pain, and how they intersect. But before we get into that, can you tell us a little bit about yourself?
Yes, I have created my own treatment method. It's called Titus Motion Therapy. I've been doing it for 30 years. I got accepted to PT school and chiropractic school and decided that this was a better way to go and to treat people more rather than just treating symptoms. It treats the whole body as a unit. And I guess I'll kind of leave it at that. I see people, I have over 95% success rate of keeping people out of surgery who are scheduled for surgery.
Wow.
And, lumbar pain and sciatic pain are the number one things that I see most often. It's something like 80% of the planet has back problems.
Wow, that's a lot.
Yes, it is. I can't even count that high.
So how do you think physical pain is connected to mental pain in your opinion, or is it connected?
I absolutely think it's connected. I think most, after doing marathons, and I went through Ranger School and a bunch of different schools in the military, I would say that everything physical is about 70% mental.
Wow.
Because like in a marathon, you get to a certain point and it's so difficult. You think, oh my gosh, I can't do anymore. And if you could just calm yourself down a little bit and not get on that anxiety treadmill and think I can't, and can, take a step back and refocus. But in terms of what I do now, pain is exhausting because, you're mentally, if your back hurts, or if you have sciatic pain and you say, I'm going to go to the grocery store today. Well, that's a lot. You have to think about getting there, getting back, buying everything, pushing the cart around, standing in the line to check out, and unloading the groceries, getting out of the car, all of these things. And you're thinking about it because of your symptoms. And so, rather than just sat by somebody who's pain-free says, I'm just going to go to the grocery store. Well, it's much, much different if you're in pain. So it can be really, really exhausting.
Yeah, definitely. And I'm wondering, so I know in the mental health field, we've seen an uptick in people wanting and needing talk therapy. Have you seen an uptick since 2020 in people having physical pain?
No, I don't know that I've seen a bigger uptick in that. I have noticed, obviously, with the COVID, I've been doing it, online or through video for 25 years. My first patient when I started my own practice was in New Zealand. And so there was no internet then, but I would video myself doing what I wanted them to do, send that to them, and then they would video themselves, posture, gait pattern, and symptoms, mail it back to me, redo the whole thing. So now, on Zoom or things like that, I've used Skype before and FaceTime, but people have really started to realize that these things can be done virtually, almost easier than going in person, because especially now with the gas prices,
Yeah. And with it being so much to get into the car, to go into the office, similar to your grocery store example, people are able to do their treatment in their home.
Right.
So,
and in Los Angeles, even people who are, I don't know, say 30 miles away in the valley, like they used to just dread driving over to my office when I had an office in Santa Monica. So now people are like, oh my gosh, I don't have to drive. This is awesome. So it's because a lot of times people with low back pain and sciatic pain, just being in the car for a long time, increases that symptom. So again, that really wears on you mentally, and anxiety and those things.
So besides it being virtual, what else makes your approach different?
Well, the number one thing, how I tell people how my stuff is different, is that if I put a rock in your shoe and I say, let's go for a walk, Michelle. And by the time you get to the door, you're going to be like, there's a rock in my shoe and it's hurting. I want to take it out. Like, no, let's just work through it, because that's kind of what we do, right? You have a little pain, you're like, oh, it'll work itself out. And so we go on this long walk, and you come back and you say, my back is killing me. And you go to the PT, the chiropractor, the doctor, the surgeon, and you say, my back is killing me. What are they going to work on? Your back.
Mm-hmm.
I'm going to get the rock out of your shoe. Because until you get that rock out of your shoe, everybody's just going to be working on your back. They're not really solving the problem.
Mm-hmm.
And I only see people once a week for 8 weeks.
Wow.
Right.
That's so impressive.
Thank you.
So
I've been working at it a long time to get here. So
yeah.
Thank you very much. Appreciate it.
So how does someone know that they need physical therapy? So how do people recognize the rock in their shoe and start treating the rock in their shoe?
Well, that's a great question. It's how long do you wait once the check engine light comes on in your car, right? Do you say, well, maybe it'll work itself out, or do you really take it in and see what's going on? And that's usually what we do. We treat our cars better than we do ourselves. So, when you get a symptom, your body's trying to give you a message, say, look, something's not quite right. And we either listen to it or we don't. But it's similar, you brush your teeth every day. You really should do something for yourself body-wise. And we just sit so much in today's society that you really have to do some work to keep yourself lined up. When our parents said, sit up straight, we all should have listened.
Yeah. So that makes me think of, because I work with a lot of pregnant women or women that are trying to get pregnant or just had their babies.
Right.
And your body goes through a lot of changes when you're pregnant. And then when you're feeding, whether it's bottle or breastfeeding, you tend to curl over, or you're holding the baby. So one side of you is, lots of times I hear, okay, well, now I'm in pain because I'm holding this weight on one side of my body. Do you have any suggestions for women that are pregnant or trying to become pregnant that can kind of prevent getting that rock in your shoe?
Yes, you probably already have the rock in the shoe before you get the symptoms. But pregnant women typically have an anterior pelvic tilt because of the weight that they're carrying around, and that puts undue pressure on one side of your disc in your low back, right? So the disc in your low back, easy way to explain it, is like an Oreo cookie. If you squeeze too much on one side, it's going to bulge out a little bit, right? Oreo cookie. And your discs are really basically like that. Your body's going to tighten up on one side or tilt one way or the other, and it puts undue pressure on one side of the disc. It bulges out, hits a nerve, goes down your sciatic, typically the sciatic nerve. And lots of ways to treat that. And it's not necessarily unlike treating someone who's not pregnant, because all you're really doing is trying to get everything lined up and balanced out. Now, it's like people that are overweight as well. And what happens is, you get into some pain, so then you're less active, so then you put on weight. But with pregnant women, obviously you're getting more and more weight and more and more pull and tug all over the body. But it's basically the same, that we just need to get the hips as close to level as possible. They're probably not going to go completely level because of that weight distribution, but that's what needs to happen.
So is it better to wait until after you have the baby?
No.
No. Okay.
No. Did you see my hesitation? No. You should start as soon as you feel some symptoms, and don't think that, well, I'm pregnant and this is common, and it doesn't really have to be like that. it can, you can balance yourself out and get rid of the sciatic pain. And then afterwards, of course, there's going to be another big shift. You have all this weight and then it dissipates, and your body's not going to just automatically snap back into the correct or movement patterns. And you're probably dysfunctional movement pattern before you got pregnant. So I don't know about trying to get pregnant. That's fun and games mostly.
So I like that you said it doesn't have to be that way.
Yes.
Because same thing with mental health. You get stuck into this pattern lots of times, and it doesn't have to be that way. You could learn other coping tools. You could develop other thinking patterns.
Right.
And a big part of it, a big word that's popping up for me is the interoception, the idea of listening to your body, but we don't have a direct cell phone like stomach, what are you telling me? Or heart, what are you telling me? But it's learning those subtle cues. And maybe those subtle cues are helpful, or sometimes they're not helpful, and trying something different and seeking support for the root cause versus as you mentioned, everyone's now treating the back pain versus the rock in the shoe.
Right. I could not agree more. We need to listen to our bodies. So when we get again, go back to the car analogy. When your car makes a funny noise, you're probably going to get it checked out. But when our bodies make a funny noise or get a little funny ache or pain, we need to pay attention to that. And a lot of times people with pain will move away from sensing that pain. So then the kinesthetic responses aren't always right there. Does that make sense? That makes sense?
So whether it's physically compensating with another body part or switching how you're walking or something like that, or even, sorry, go ahead.
No. You're basically, let's say I've got a symptom in my knee and I don't pay attention to it. Well, the more the symptom gets there and you're not listening to it, then you stop listening to it, right? So then you're not paying attention to it. Then after that, maybe because the compensation from that, maybe something else hurts. And then maybe you don't listen to that. Maybe you do, maybe you don't. But we treat our cars so much better than we do our bodies, because you can hear something or that light comes on, change the oil, add oil.
Yeah. We get very clear messages, and maybe the messages are not as clear to our body because we either don't have the time, or we're choosing not to listen, or we're doing other distractions, whether it's watching TV or dealing with something else, or not having the time to listen. Yes,
all of those are true. What is your experience in your practice with people with pain, and how do they get through it and things like that?
Well, usually with pain, since that isn't my expertise, I usually refer out and create a network of support for those people based on their needs. And I like to have a collaborative approach. So working with other professionals and then having team meetings with the proper authorization from the clients who all work together based on our area of expertise to get the best results possible.
I agree. I couldn't agree more. Do you find that once people have at least some pain relief, are they able to focus on other aspects of mental health?
Definitely. It's kind of like if you have a mental health condition and you have addiction, you need to treat both. You can't just choose to focus on one or the other, because they go back and forth and it's that cycle, and it's learning how to get out of that cycle and having the proper support with the people who specialize in each field and having them work together, communicating to get the best results, because we don't have a check engine light necessarily that goes on. And it's like if you have a Porsche, you're going to work with a mechanic who specializes in a Porsche. If you have a Ford, you want someone who has experience working on Fords. Right.
I get that. And with the rehab people, the addiction people, I think it's really, really important to help them get out of pain, because they can go through the whole rehab process and think that they're well, but if they go back out into the real world and they're in pain, then they're probably going to start taking medication.
Mhm.
And, it can be this really, really horrible cycle, like what you're saying.
Yeah. Well, thank you so much for being here today. Anything else that you want to share with the audience before we end today?
No, that's it. TitusMotionTherapy.com. I can answer any questions. That's it.
Great.
Thank you so much.